Didn't realize.
I pressed the button already.
Right. What's going on, guys? Happy Monday.
Yeah, it is Monday.
Feel like a Monday too, so.
Yeah, for sure.
One of them days.
I didn't put a title on that. I'll go back and do that. But what we wanted to talk about today was what to do during a flare-up. How do you control this thing that's going to happen eventually? With the herniated disc, with the back injury, down the leg. So how do we deal with this flare-up? So the very first thing that we talked about was the ability to recognize, okay, it's happened. How serious is it? Is it going all the way down? Is it just here? What's my motion look like? What's the pain level, the intensity, so we can kind of determine, is this something that we need to go into the emergency room for?
Right.
Or can we take care of it at home without, involving the next level of care? Also look back kind of from the day or two before and kind of determine, what could have been a possible contributing factor to this. Something that maybe you did.
More, where you sit more, where you're doing some activity your body is not used to. Any little change can actually, if your body's not ready for that load, it can cause a re-aggravation or an injury. So.
And sometimes not even right at the time. Usually it is pretty quickly after that thing. But I think change was the best word there. Like if you're like, well, I normally do these things, and then all of a sudden, yesterday, I sat in the car for 5 hours, or I did something different. I walked a bunch.
Yeah.
All right, I'm right over there.
You also want to recognize, is this a familiar pain, something you felt before, or is this something totally different? Because that could be going on too. So you want to determine, is this a flare-up of the condition you're experiencing, or is this a whole different episode of something new?
Same side, opposite side.
Yeah.
Similar location, different locations within the front, the hip, the groin. Is it something that's good? That's a good point. Yeah. Number two, we'd want to go back a few steps. Just explain kind of what you want to do. You've got help. You're improving, and then you have this flare-up, which is totally normal. I mean, the biggest predictor of future back pain or future neck pain or something that's happened in the past is that you've had it before. So it's going to happen at some point. But just realize what you can do to kind of go back a few steps, like in the force.
Yeah, so if you're squatting or something, maybe you need to lessen the weight or change the activity that you're doing. So whether it's lowering the intensity or lowering the volume, you don't need to stop whatever activity you're trying to do. You just need to modify it so that you're able to do it within the range of pain that you're experiencing.
And following your, red light, green light, yellow light. I mean, you could also regress the force and go back to some of the earlier exercises, weeks or months ago that were working then, that you kind of, let's say, graduated from or progressed from. You're like, oh man, I can't do, these things, but I'm going to regress the force and go back to the ones I started with 2 months ago. And that might be, you might be able to fix that on your own, remembering doing the things that you learned from the previous, when we started.
Absolutely.
The third one.
Yeah, so if you can try to find a position or a movement that gives you relief, basically just recognize what makes me worse and what makes me better, because that can give us and yourself a lot of good information for things you can modify or change to find a position of relief or find a movement that you can at least alleviate that pain that you're experiencing. And that can kind of guide where you go throughout this episode.
It definitely guides you. The mechanical cause and effect relationship of trying to find a position, standing, sitting, lying, or direction, bending, extending, move, what is producing and changing. It should give you a sense in your brain of okay, I know if I do that movement, that's worse. If I do that, that feels better. And it could be different from what it was, weeks ago, months ago.
Yeah.
So, but now that you're educated and you understand that these things are mechanical in nature, then that movements and positions and postures and activities, bring them on and change them, try to find something that consistently or mechanically changes that symptom, and that'll be you'll be way ahead of the game. Like Jake said, if then when we talk about it, you may not even have to come in. You just say, hey, this happened, I feel better when I'm up walking around, worse when I'm bending and sitting. Okay, keep walking, keep walking around. If it's better,
stand up,
do this direction, try this, and we can maybe just guide you, either over the phone or virtually, like on a video visit, and it may be able to save you an actual in-person session, but if we can't, maybe we'll have, we talk about it when we come in.
Yeah, sure.
Number 4.
Light movement. Yeah, so the worst thing to do is just do nothing and rest. So any sort of movement that you can do is going to be beneficial. You might not be able to do the big, huge movements that you'd like to do, but even light movements like sitting and like slouching.
Yeah, like
okay.
here, let's use this here. Some, like Jake said, walking. What's totally out is bed rest and laying down. I mean, if it's so bad you can't do anything, lay in your stomach, put some ice back there, and even if you just kind of, prop a little bit and then come flat, or just in sitting, work on a little bit of like slouch over correct, kind of come back and kind of a little bit of movement. Maybe it produces some pain, you come right back out of it tall. Something to kind of keep yourself and keep the blood flowing. The blood is carrying the oxygen that those tissues need for healing. So you need to keep moving, even light little bits. Nothing heavy, like I said, nothing crazy. Just
crazy.
Keep it moving. We talked so no bed rest.
Yep.
And then I put for number 5 just either some ice or some heat for some
just some temporary
analgesic.
Yeah.
It doesn't fix the problem.
Not at all.
But if it feels better, I like ice. I think Jake for the most part would prefer ice in an acute flare-up when you're like, oh, it's so bad. But some people just don't like it and they get a better result with the heat, and that's fine.
Yep.
As long as you're following your kind of like what makes you better, what makes you worse. If it's going further down a leg or an arm, obviously that's wrong. We can't have that.
Yeah, definitely.
But if you bring it up and it's relaxed or reduced, stay with whatever that is.
Absolutely.
Any other ones those are the 5 that we wrote down.
Yeah, I think those are the good ones.
Okay.
The main things. Yeah.
So just to recap, in an acute flare up, which is absolutely normal, and I wouldn't even consider it like it's part of the process. It's going to happen.
Right.
It's going to happen.
Ebbs and flows.
It would actually be normal if you had a steady improvement with no hiccups or ups or downs. I'd be like, okay, that's kind of weird, but usually something happens at some point. Recognize what it is, how it happened, how serious it is, okay, and then look back to what could be some contributing factors. Then go back to your movements or the basic things that we started with. Reduce some of the force, some of the intensity, like JK pointed out. Let's just say you feel better with some light movement and squatting, but just go, obviously just no weight, just body weight. So reduce things down. 3, try to find
something that relieves it. Positions, movements, anything like that. If it's better laying on your stomach, lay on your stomach. If it's better laying on your back, prop up your legs, prop your legs up.
Exactly.
Yeah.
If it's on your back and your knees kind of flexed, up a little bit, do that. That's fine. 4.
We got light movements, so he demonstrated like slouch over correct or little things like that. Cat camel,
walking,
yoga stretches.
Stay active. Just no bed rest. No just laying and not doing anything.
And then ice or heat.
Ice or heat. Okay.
That's it,
guys.
Cool, thanks, guys.
I'll put the title in here in a second.
Happy Monday. We'll see you.
Okay.